Good afternoon, everybody. Today is September, I should have changed that on here. Today's September 17th. I didn't change the front sheet, sorry about that. September 17th, 2021. This is Scott McGann with the Falmouth Health Department doing our weekly COVID-19 update. Our email is health@falmouthma.gov. Our phone number is 508-495-7485. This presentation, along with the numbers that we get for the week, will be on the COVID section of the falmouthma.gov website. So it's been another tough week. We have 1,882 cases since the beginning. First case on March 19th of 2020. 71 cases during the week. 10 probable cases this week, which is the rapid test. About 94.5% of all total cases are no longer in isolation. Our 14-day incidence rate jumped from 20.6 to 30. What that means is per 100,000, if you had a population of 100,000, you would be averaging 30 cases a day. Okay, so since we have about a third of that, that means we're averaging about 10 cases a day. So our actually daily average, when you put this up, if you want to know what it means, is just divide by 31.5%. But to be rough estimate, you just go by a third. So 30 cases per day comes out to 9 point whatever. So that's what our daily case count is roughly, and that's what our incidence rate. This is a 14-day incidence rate. And it's starting to capture both our bad, last couple of bad weeks. Our positivity, which is just the total number of positive tests, even if somebody tests a couple of different times to verify it through a PCR, it would still show up. But anyway, it's basically those total number of cases divided by the total number of tests, which we average about roughly around 1,200, 1,300 per week, is 4.92%, which is a jump from 3.67%. So we have jumped in both of them. I'll talk a little bit more about that later. This is our case count. I put this also on the website. It shows we had 5 weeks of sustained around 20 confirmed cases. We've jumped 50, 60, and now 71. A little bit about the cases. There's been a couple of clusters that are associated with it. One with a wedding party back in the late August time, which still has some cases popping in because once somebody family, then another person in the family. So it takes a little bit of time for that to work through. And another is a long-term care facility. If you add those two up, it's probably over the last 3 weeks, somewhere about 30 or 35 of the cases. Still, though, out of all the few hundred cases, the 150 or so cases, it's still only around between 10 and 20% of the cases. So still, most of these cases are community spread through whatever various ways that you get it, through parties or gatherings or, trips, or it could be just going to an office or something of that nature, or definitely into families. We do notice that with Delta spreading as well as it does, it's more communicable. And because of it, you do see it go through households even a little bit more vigorously than the previous versions of COVID. So that's where we are with cases. The way to look at this chart here, this is the flatter and closely clumped together those little dots are, the better we're doing. When you see them spread out and jumping up vertically rapidly, that tells you we're on an increase. You can see where we had that sort of winter around the holidays and then another jump in the spring, and now you're seeing another jump now. So it's sort of like our, sort of third, for us anyway, the third time it's rapidly gone up. So that's where we are with cases. This is Barnstable County's. This is as of the 13th. It's the last time the county provided me with this. So the average is about, for over 3 days, roughly 50, 60 cases per day throughout. We're about 10 or 11% of the population. So we're sort of slightly higher. We're driving it a little bit more than we normally do. Usually we're on middle to lower, slightly lower end of average. We're a little higher, and I'll show you that in a chart coming up in a minute. As far as hospitalization, so the key to vaccinations, they are effective for the serious, and I got another slide to show you that, the serious portion of COVID. So the hospitalizations are still at a manageable state since, the last time I showed this on there, I take them off over time, is you have 3, 4, 3, 5, 6. So it's not a substantial increase, though you see more ICU. And usually, again, if you have a long-term care, that's going to be problematic even if they are vaccinated. They were vaccinated quite early, I'd say January. There's some waning vaccine, the ability of the vaccine to be as productive. That's part of it. You also have unvaccinated people as well, and COVID definitely makes it more severe than previous. Delta Delta is more severe than the original version of COVID. But still, that being said, it's still at a manageable state, both at Cape Cod and Falmouth Hospital, which is a great sign. That's, to me, one of the most important things. In terms of the state, there was 2,000 cases reported this day, 16 deaths. The hospitalizations is at 675. The positivity hasn't moved much. It's been between 2.25 and 2.5. So that means there's been an increase in testing, and a lot of healthcare facilities are going back to weekly testing, and that probably drives some of that number to stabilize, even though you're seeing an increase maybe from 15 last week to 2 now, 1,000 cases. The positivity hasn't moved much, and part of that's because of the increase in testing, and probably an increase in routine testing as well, such as facilities like healthcare facilities primarily. Looking at the trends, you can see that, again, testing at 2.3, which is the green chart, shows you that it's pretty relatively flat over the last month or so. Cases are up, not sharply. Hospitalizations are starting to show a tick up. And deaths are it's slightly up from maybe July, but it's been on the flat side. So I think that's where you see the vaccinations helping. Even though you see an increase more sharply in the blue chart, which shows cases, you see it a little bit flatter for the most part, at least with deaths. And that's, really key is, lower hospitalizations, lower deaths. So this is going back to incidence rate. The state of Massachusetts total incidence rate is 23 daily cases per 100,000 of population. You can see Falmouth, we're now on the high side. We've not had a good last week or two. You see that we're at 30, Sandwich 30.2, Barnstable at 28, and we're driving the numbers higher over this past week. There is an ebb and flow. It does happen. We've generally been better than average, but this week we've had a bad week. And so, again, part of it is with a couple of clusters, but that's not the primary driver of this higher count. So that's where we are with that. As far as percent positivity, you can also see we're more on the higher side over the last couple of weeks. We need to help, we need to drive it down, and people, everybody out there just, think about what they're doing and, whether they want to make decisions such as wearing masks. We still have a mask advisory. I'll show you when, the line in the sand that the Board of Health and myself have thought about drawing is based on CDC. We'll show you that in one of the last slides. But the cases are up, and you just need to be aware of that. Vaccinations, not much of a change in vaccinations for the county. It still remains at 72% fully vaccinated at the county level. Our vaccinations, we had an increase of 208 doses. Actually, I didn't add that up right. That was last week's number. So 133, so 243 is actually our number. Sorry about that. So 243 administered during the 7-day period, with 88% of all eligible residents receiving 1 dose. 80%, we hit the 80% mark this week of all eligible residents are fully vaccinated. The increase has been sort of through all. Actually seen a good jump in. We had a little bit of a jump in the older bracket, with the 65 to 74, and also getting second doses. We did a little bit of a nudge with second doses above 75, which is great. It's not too late to get your second dose. Countries like, I believe the UK, gave everybody a first and then went to the second. The 21 days for Pfizer and the 28 days for Pfizer was based on their best estimate. They may find out in a year or so or 6 months or so that extending that time frame might be better, for those that are vaccinated. So it's not too late to get your second shot if you haven't. So get your second shot. There's always seems to be somewhere around a 7% not. You can see it in the 50 to 64. You see 88, 81. You see almost the same. You see the same number at 65 to 74. For whatever reason, that's really between 7 and 8%, pretty across the board between all age groups. That about 7% of the people do not go back to get their second dose. You would be, if you have 1 dose of J&J, you're considered fully vaccinated, so you'd fall in the right-hand category. So I encourage those who have not got their second doses to get their second doses, especially now. And I want to say that now because once we get more information and we start doing booster clinics, then you're going to go back to people that are fully vaccinated, that 80% of all eligible residents that want that booster are going to be in line getting a booster. and it's the same shot. So that being said, if you've been on the fence or you just haven't gotten around to getting your second dose, you want to do it before we start doing that, because there's going to be a little bit of a crunch. I don't know if the vaccine is going to be flowing to a point where it's not going to be an issue, or there might be somewhat of a bottleneck. I mean, we know what happened over this past spring. So again, get it now. If you're either going to if you're on the fence about getting vaccinated and you think you're going to do it either for the first time or your second dose, do it now, because there's going to be a little bit of a crunch at the beginning. And might as well get it over with now and then not have to deal with, maybe having trouble getting an appointment initially because there's just that wave of people who want that third dose. It is the same vaccine, by the way, so it doesn't, it's the same thing. The third dose is the same as what your first and second is. This is from the state that's put out every week. This is cases in fully vaccinated individuals. So as of the 11th, 9/11, there were 27,777 breakthrough cases. 823, or 2.9%, were hospitalized, and 194 deaths, which is less than 1%. So that tells you, I'm not Dr. Fauci. That just tells me that the vaccinations are highly effective, because those numbers are much higher among the unvaccinated. But that tells you that 3% hospitalization rate and less than 1% of a death rate is a pretty good number considering the severity of Delta. So, highly effective vaccines are highly effective in keeping you where it matters. Now, what I do notice is that the cases, your cases, what they mean by mild may not be what you think. You could be a fever for several days or a week. You could feel lousy. It doesn't mean that you don't feel anything if you do get COVID. It just tends to not manifest itself to needing hospitalizations for the most part. But you're going to be down and out. It could be as little as asymptomatic all the way to, down and out for a week, kind of like you would be with the flu. Aches, fever, congestion, stuff like that. But, those, as long as you're not in the hospitalization, you're not hospitalized, it's considered I would consider it a mild case. So, again, get vaccinated if you can, my suggestion. Or you can, if you can. So where do you get vaccines? So right now, vaxfinder.mass.gov. Pharmacies, the health office once a week at Barnstable County on 6A, Convenient MD had some, Community Health Center of Cape Cod. Homebound, you would call the health department. If you have somebody that's homebound, we'll have to make arrangements through the VNA, and we'll do that. In terms of boosters, the state has asked each town what their capacity is. I don't think they're going to be opening mass vac sites. They haven't said that. So it's going to fall more on the local health departments in Barnstable County, and we'll be running clinics. We can run clinics. We've got staff. We'll be using Barnstable County. We'll be using the VNA. We'll run as many clinics as we need to do this. But right now, how it's all going to work out is, I think they're still working on a game plan. It should come out at any time. Testing. Well, for Convenient MD has still been an ace, and so has CVS and Falmouth Hospital. We still have the fairgrounds, which is free Sunday and Thursday, and those dates I'm working on maybe getting an increase in that, but we'll see what happens. Then the Community Health Center have been mainly our main testing. I want to spend a little time talking about school-based test and stay. DESE, which does the Department of Elementary and Secondary Education, I think it stands for, is set up a test and stay. So if it's a school-based exposure, they would test for 5 days, those that were exposed, as opposed to quarantining. There's no remote option, so to keep kids in school. It comes from DESE. It's not, Falmouth Public Schools doing it on their own. It's a state program. There are bugs to work out. I'm talking to parents, bear with the school department. It's not easy for them to pull this off. And they need to get their groove and get their, you get a guidance, you have guidance sent out to you, but how it works in the nitty gritty and the detail, obviously you don't know how exactly it's going to play out, once you get started. So, when you get called by the school, there's been a lot of there's been a fair share of upset parents. And the school's just basically doing what the state says they have to do. And the details on how it works out will need to keep improving. I talk with the schools every week. We talk about best way to do it. And so just, again, bear with the schools. We'll get, there'll be a well-oiled machine shortly. It's just, the mountain of paperwork that happens in the testing, and, it's not like, you just automatically have an inexhaustible resource of staff to do that. And so the adjustments are being made, and it'll get better as time progresses. And hopefully the cases go down because we started at a high level. We started with 60 a week as opposed to starting with 20 cases a week. So there's just more community spread. There's more things that can go wrong. There more things that go wrong show up. They manifest it all over the place, including schools. And so you start hard and heavy on it, and it gets So it's going to get better. I just want to everybody who's a parent, if you get the call, if you have to deal with it, just bear with us. They're doing the best they can. Okay. So I just wanted to say that this has been a tough week with schools, with sort of making sure we figure out the logistics of how to do it and how to get it all done. Sometimes the best laid plans, you have to make tweaks, and that's sort of where they're at now. So again, parents, just bear with us. Again, get tested if you have symptoms. And the other thing I want to say too about this is that a lot of COVID, especially if you're a very healthy person, it may manifest as something more mild than you may think is COVID. And so a lot of sometimes people aren't getting tested and going around spreading it because they may not know. So get a test if you've got any sort of symptoms, upper congestions and so forth. So I think we're doing it in general because 1,200 is a very robust amount of tests per week. That's a pretty good chunk of the population getting tested every week, even though some of it's maybe routine based on their business, healthcare especially. But yeah, get yourself tested, and follow the guidance, isolate yourself, and that should help. In terms of third doses, this slide's been up for a couple of weeks. I hope to have more information to give you. It's still immune compromised. We should get a third dose at this point. State hasn't rolled out their game plan to me anyway, so to the towns anyway. So we'll put this out when it's time. And if the state says to us, like I said before, that towns, here's all the doses, we'll start running clinics. We can run them at schools. We can run them at senior center. We can run them at the rec center. We can do drive-throughs. We can do walk-ins. We'll always have the fairgrounds. I think the fairgrounds would be the place that the county does from. And then other places like the hospitals and the community health center at Cape Cod that helped us out a lot. So, how that's all going to work right now, we just need the game plan from the state on, what they want our involvements. And again, of course, you have the pharmacies, which have always been heavy hitters on vaccinating. Face coverings. Back in May, again, we had a mask advisory. The state in July said the unvaccinated, vaccinated with weakened immune systems, and anybody doing public transportation should be wearing masks. CDC said unvaccinated should wear a mask, and vaccinated should also wear masks indoors in areas of substantial or high transmission, which I'll talk about in a second. And state required, actually that's 2 weeks ago, I've got to fix that, to start the school year with full masking. In the CDC's weekly morbidity or mortality report, which we get, they came out with their guidance on further mitigation beyond essentially no mitigation. No mitigation. We don't have any capacity limits or anything of that nature. So they look at substantial or high transmission rates, which would be a incidence rate over 50. Which for us would be about 16 cases per week, 16 to 17 cases per week. Per day. Sorry, I didn't mean to say that. Per day, which would be about 115 or so cases per week. And our positivity would go over 8. So we've been pushing that line. You can see we've had a 9.4 daily incidence rate, so 3 more cases per day than over the previous time frame, the 14-day that the state grabbed this data. And then our positivity still remains under 5, but 4.92 is getting up in the high. Over 5, it really starts, you can have a tendency to go a lot higher. So, again, an individual's activity drives these cases, and I think it's time to just sort of think about what you're doing and do your best that you can to sort of mitigate your risk. But that line in the sand, again, would be 50 cases or higher per day per 100,000, which would relate to about 17 cases per day with us. Okay. And the other things that they want you to look at are hospitalizations, which I think we're still holding on. The hospitals and the hospitalizations are still relatively low for the case count. And so that helps because of the vaccination rate. And again, our vaccination rate's robust. So these 3 things are what we're 4 things. Incidence, percent positivity, hospitalizations, and vaccinations are the things we should be looking at. The main driver for us is going to be, because I think we already always will have the check mark of good with the vaccinations. It'll be hospitalizations and whether we jump from moderate to substantial in any of those two categories, primarily incidence rate. I think that's more, the biggie. So, we've another 7 cases per day average, and, the Board of Health, it will, have to decide whether they want to go into things such as a mask mandate or anything like that. So that's sort of the line in the sand that we drew, and we've been inching up towards it, or actually sort of walking quickly towards it, and let's hope we can mitigate it and not have it occur, but that's where we're at with that. As a review, case count's been up for the last 3 or so weeks. Our incidence rate keeps jumping. It's been the second week in the moderate. Vaccine eligibility, we're averaging 200 plus vaccines a week. If you're on the fence or haven't gotten your second dose, you'd want to do it before you're fighting others for, I hope it doesn't happen that way, but there's always going to be. I mean, we just can't take care of everybody in town in a week. So this is the time that it's much easier to get vaccinated. So if you need your second dose or you decided you want to get your first dose and get vaccinated, this is the time to do it. Resident vaccine rates, we've always been good. We've always had robust, compared to our peers. Maybe average for the Cape, slightly higher for the Cape maybe, and then pretty similar, and then definitely better than most towns off Cape, and definitely better than most states. Again, vaccine breakthrough does occur. It does seem to be, looking at the cases and the contact tracing of cases, it does seem to be much more mild for the most part if you've been vaccinated. Not seeing as much hospitalizations. And again, the one thing I wanted to say today is the test and stay program in school is new. Just bear with the school department. It's not something the school's necessarily used to doing. It's a little bit different. It's a test and stay and test every day for 5 days if you've been exposed in a school setting. So, the more cases you have, the more testing you have to do, the more paperwork you do, the more you have to do all this other stuff about it, contact parents, things of that nature. It's just, it is a bear to do. So I think I spelled bear wrong. Sorry about that. That's it for the week. Any direct questions, you can email or call the health department. And we will see everybody next Friday. Thanks.